What's up, guys? We are here to talk about stem cells today. All the different types, which are the best ones for your injuries possibly, and how to go about the best approach to heal. So today we are here with the amazing Dr. Brian Mehling from Blue Horizon, and he is one of the top leaders in this. He has an incredible charity. We're going to get into his background as well and the charities toward the end of the video, but first we're going to give exactly what you guys have been waiting for, specific details. So once again, guys, this is Greg White from I'm a comic book artist, a writer, and film director from BeyondComics.tv, so you can see some of the work there. And again, for a lot of us out there who are struggling with different types of injuries, it can impact us, especially if you're in the arts like I am and you have shoulder issues, or if you're a runner or a dancer and you have knee issues. So this guy over here is one of the leading masters who will be able to help inform you, and we'll definitely post a link to how you can get in touch with him in the description below. Make sure to subscribe for updates, post your comments below, guys, and we're going to start right now, so please introduce yourself and tell everybody about you and what you guys are doing.
Well, thanks, Greg, very much for having me.
Absolutely.
And thanks again for being such a great guy, always.
Oh,
such a wonderful person.
Thanks
for supporting our foundation.
Absolutely.
And thank you for inviting me to be on your broadcast. So, my name is Brian Mehling, and I'm an orthopedic surgeon in the New York metro area. I work in New Jersey and in New York, in Long Island. And my friend Eddie Amarante and I, a couple years ago, started a stem cell business. And originally we were going to open in Dubai, and then they had a little bubble burst in December 2009, and so we went to China, and we met this amazing pioneer in stem cell research, Dr. Wu. So Eddie and I did our first stem cell treatment in Wuhan, China in October 2010. So we didn't know what to expect, and we were flying back home, and we went to Hong Kong on the way back, and we thought, wow, we have a lot of energy. And so when we got back, we noticed that Eddie's blood pressure was normal. We had to take Ambien for a couple weeks to go to sleep. I did 16 surgeries in like 3 days, and I still had to take an Ambien to go to sleep. And usually coming from China, the fatigue after, you know, the jet lag and stuff like that is usually just horrible. And I didn't have any of it. I felt great. And so we're like, wow, this is not like the placebo effect. This is like really something.
And where did they inject you specifically?
So what they did is they harvest the stem cells from the placental cord blood after C-section when the baby's born, and there's no injury to the baby or the mother.
That's terrific.
So yeah, basically C-sections are super common in China, and the ladies there take excellent care of themselves with all the prenatal testing and everything like that. And so it's a really very, very excellent source of cord blood, stem cells. So this guy happened to explore all this research there. We met him and we did the treatment. They harvest the stem cells on the day the baby's born. Again, there's no injury to the baby or the mother at C-section. If the family doesn't want to save it for themselves, they can donate it for a patient.
This is the placenta that you're talking
about.
Yeah,
they take the placenta and the blood is in it. So then they take the blood out, and then we can actually also use the placenta itself for culture. So that's another source of stem cells I'll tell you a little bit later about. But predominantly we use the cord blood. It's processed on the day the baby's born, and if you have the treatment in China, it's fresh. The baby's born by C-section maybe at 9 or 10 in the morning, and you have your injection at like 2 or 3 in the afternoon.
Well, so it has to be done the same day, is that right?
It doesn't have to, because what we do for people that aren't going to China, for instance, we have a facility in Slovakia, and we're opening in Jamaica next month, and a bunch of other worldwide locations. We just freeze it, and then we thaw it out on the day the patient's going to get the treatment.
Great. And
if you're very careful with the freeze-thaw cycle, you can have over 90% viability. So we generally have about 90–95% viability, and then we suspend it in some saline, and then we inject it into the patient. IV, generally, everyone gets an IV injection. Then if they have central nervous system pathology, we can also take some of the stem cells and directly inject it into the central nervous system with a lumbar puncture. So it's just like spinal anesthesia or something like that, where they put a needle in the lumbar spine, and they take a little bit of cerebral spinal fluid out, and then they put the stem cells in.
Really? And is that for someone who has back injuries, or just to get it?
Well, that would really no. That would be like someone that had stroke, dementia, Alzheimer's, Lou Gehrig's disease, multiple sclerosis, depression, bipolar, schizophrenia.
And the idea is to use this to help reboost their energy level in this particular
Well,
case.
if you inject it into the central nervous system, it's to regenerate neurological there's a theory out there that inflammation is, or maybe it's not more than a theory, it's the truth. Inflammation is the source of most disease, one way or another, okay? So somehow related to some type of inflammatory issue.
Okay.
So even mental illness, it seems like. So it modulates, we think, the immune system and the immune response, but also we think it helps regenerate damaged tissue. So someone that's had a stroke or a spinal cord injury or something like that, it actually helps the brain repair from the damage. My friend Eddie, as you know, he had a really catastrophic head injury.
Yeah.
They didn't know if he was going to even survive, basically. And he was in a drug-induced coma for over a week. And then they gave him, he had done stem cells before, of course, and this was after the hurricane, and then after, he did a bunch of treatments, and he's like normal now. I mean, he basically had a full recovery.
Wow.
He still has a seizure disorder, and he still has a little hypertension, but he had hypertension before anyway.
Okay.
And so for that type of thing, we use a central nervous system injection with a lumbar puncture. We can also give mannitol in the IV, which is like a sugar found in milk.
Okay.
And if the patient doesn't want to do the lumbar puncture, we can also get more cells into the central nervous system just by giving the sugar in the IV.
Really?
They don't go through the blood-brain barrier.
That's great.
And then the stem cells can go directly into the central nervous system to get not as quite as strong as an effect as the lumbar puncture, but easier, I suppose.
And that's if someone does not have diabetes, for example, right? If they do.
Well, actually, diabetes is a peripheral problem, so that would just be an IV treatment.
Okay.
So, for instance, in our experience with diabetes, after about 3 injections, most people don't need insulin anymore. So,
really?
a lot of people are able to really make a big improvement in their insulin and like their endogenous insulin production.
Okay.
And don't require insulin stuff. They still may need, a pill or something like that, some kind of.
So let's title this, for example, the the IV version of how to get it through the system, right? And in this particular approach, now this is not how you would treat, for example, shoulder, knee, neck, back injuries, right?
Okay, so for shoulders, knees, a joint, ankle, elbow, that type of thing, we would generally inject a portion of the cells directly into the joint.
Okay.
Okay, and then we'd also get an IV. So you can just do everything IV. We take the entire yield of 1 placenta for 1 dose, so it's 300 to 400 million cells. Most of the other providers worldwide do about 25 to 50 million cells, and we found that is just not enough to get a strong response.
Wow. And how does it last once this is done in joint injuries?
Right.
Do you have to repeat it every year?
It kind of depends. So, for instance, if someone has a single event type injury, like a spinal cord injury or a stroke or something like that, and it was like a one-time occurrence, then probably the gains they make after the stem cell treatments will be permanent, okay? But if it's something like diabetes or Alzheimer's or some kind of autoimmune disorder like lupus or something like that, then probably you're going to need to keep doing it, like boosters every year or 2 or something like that.
Okay, to repeat.
So, because eventually, for instance, if you just do 1 injection, then the diabetes. Well, first of all, for diabetes, we recommend 3 injections. But let's say you just do 1, you might get a little bit of improvement, but then a year later, you might need to do another one.
And some people respond, some completely don't. Correct? It's just a.
Well, it's just like anything in medicine. Some people don't respond, but I would say almost. I can't think of anyone that didn't respond after 3 injections. There are a couple people that don't respond too much after the first, and rarely after the second injection, they don't really feel much different. But if they go on for a 3rd injection, almost everybody, I can't think of one patient that didn't feel some improvement after 3 injections.
Really? Wow.
But there are, I would say about maybe 15% of people don't feel much after the first injection. And which can be a little disappointing, of course, but you can't really know why.
Things like
well, no, for like joint, for all takers, basically.
Okay.
Diabetes, they would normally do 3 injections.
Now we're just back to the joints again and what seems to work. Now also, there's been such a conflicting messages as which type of stem cell seems to be the most effective for which type of injury. So, for example, for those of you guys who are watching out there, I know some of you know this, but for those who don't, I just want to list some of these things out. We know about, of course, stem cells from being taken from the sternum or from the hips, is that right?
Right.
And that's the bone marrow aspiration, right? Which is basically where they put a needle in, they withdraw the, if you want to explain that.
Sure,
yeah.
so basically I'll go through the different types of stem cells.
Okay, so here's
Basically, in the United States today, there's a couple approved sources of stem cells, and that's basically fat and bone marrow. So for the bone marrow aspiration, which I tried myself, they just do it under local injection, or I provide that service, or for instance, it's FDA approved. You know, a lot of people do. You do a little local anesthesia. You put the needle into the hip bone, and you draw out what's called the bone marrow, but it's like a special kind of blood that's very rich in stem cells. And basically, then you centrifuge it, and then you take a certain layer from the centrifuge that's very rich in stem cells.
Which means like spinning it around and things.
Right, to divide the cells by their weight. And then you inject those. And those are effective, and it's generally about, I think it's about $4,000 or $5,000 for an injection of that.
And also, for one aspiration on one hip, let's say for someone about 45 years old, for example, or 40 years old in that age range, how many stem cells seem to be captured in that one aspiration?
Okay, I don't think we really know, but I don't think that many, to be perfectly honest with you, because it's a very, very mixed collection of cells. Okay, there's plenty of stem cells in there. It's called stem cell. It's called a bone marrow concentrate. They actually don't even market it as a stem cell treatment. It's a bone marrow concentrate because they can't really establish how many stem cells, I don't think, are actually in 10 cc's of that or whatever.
That's like one syringe, right?
You don't even get that much. So you probably get about 2 cc's or something like that so honestly, I really don't know, but I would be surprised if there's even 1 million. You know what I mean?
Wow.
But that's still more than you have, it is a pretty effective treatment.
And that's enough for like one joint to be effective?
Yeah, so you could probably split that to 2 joints.
Okay, so like...
But it'd be better to put it into one,
so
right?
about 1 million stem cells...
Well, I don't know how many. I mean, don't quote me at 1 million, but
But on average, you've seen it to be about...
No, they don't measure it. They don't publish the amount. They just they call it a bone marrow concentrate.
Okay.
So I don't know that anyone's really quantified how much their brand, you know what I mean? They sell these kits.
Oh, wow.
So you basically get the kit in your office, or in Slovakia we have our own lab that does it, so we don't need to buy a kit. But
I see.
Generally in the United States they have these little kits, one-off kits.
Gotcha.
So they do the same thing for fat. So you can do like a little liposuction in the office.
In the stomach, right? Lower belly.
Well, anywhere they want to lose some fat.
Okay.
Some fat, and then they process it again to isolate the stem cell rich area. You know what I mean? And then they inject that.
Interesting.
And that's another good source of stem cells. We actually, in our labs, we use those as sources for culture.
Okay.
So we can culture the fat stem cells. We can culture the bone marrow aspirate stem cells, and then about a month later, we use the 300 or 400 million cells we get from culture, which is not 1,000 or 100 different cell types. You know what I mean? It's a stem cell culture. And we inject that, and we inject IV or intrathecally or
Intrathecally means
into the back,
into the back,
of the central nervous system. So that's something. But here, that's not FDA approved. In the United States, you're not allowed to manipulate the cells more than like a simple wash and centrifuge and inject them into the patient. So it pretty much has to be the same day. You're not allowed to, or at least within 24 hours, you're not really allowed to culture or stimulate the cells. Now that's of course going to be changing, I'm sure, soon.
Is there any prospect as to how soon that would potentially be approved in the United States?
Well, I'm very hopeful that Donald Trump will lighten the regulations on stem cell research.
Okay.
So it seems that he plans on eliminating a lot of regulations, and that is one thing that is really holding the stem cell industry in the United States back is,
Did you
what
hear
I consider probably be a little over-regulation. So we are submitting some, at Blue Horizon, we are submitting for FDA trials. We're going to do a stroke trial, probably diabetes trial, and then we have some orphan drug applications that we're going to be submitting for.
That's great.
And so that will go through the traditional FDA track.
Sure.
But in the meantime, we are also exploring a lot more opportunities with stem cells in our overseas facilities.
So, what about also, or any plans to open up something maybe in Cayman Islands or somewhere where it's closer?
We're opening in Jamaica, so it's 3 hours and 15 minutes.
How far is it there? 3 hours?
Yeah, it's
great.
Closer than the Cayman Islands, actually. I think the Cayman Islands is more like 4 hours. We went to the Cayman Islands, we met with the Minister of Health, and it's a good location. It's beautiful, but to be perfectly honest with you, there's not that many flights there.
Oh.
If you try to fly there direct from New York, there's not a whole lot of direct flights that came out from New York City.
Wow.
Even all 3 airports combined. There's probably 50 flights to Jamaica. You know what I mean?
Really? Wow.
I mean, maybe not 50, at least 20.
Okay.
I mean, maybe 50 if you include all 3 airports. There's so many flights to Jamaica from New York alone. You know what I mean? And then of course there's flights from all the other major U.S. And there's all kinds of flights from Europe. So it's really good for medical tourism. You know what I mean?
This is great. And also, do you know if they allow to go, let's say, to Jamaica, have the stem cells cultured to multiply them, and then, you know, obviously re-inject them back into the body so you have more? Can that be brought back into the U.S. and done here? Does the person have to fly back out again?
No. So well, in Jamaica and in Slovakia, basically, we generally offer the cord blood stem cells, because even if you culture your own stem cells and get 400 million of your cells or something like that, they're still as old as you are. You know what I mean?
That's the umbilical cord stem cells.
No. If you take your own fat or your own bone marrow and grow it, okay?
Right, no, but when you said cord, you mean the umbilical cord stem cells.
Right, so first is the umbilical cord or the cultured Wharton's jelly. So
okay.
At Blue Horizon, there's basically 3 sources of stem cells. We have the cord blood, which is not processed at all. It's just washed and centrifuged, essentially, and of course tested for diseases and everything.
It's an umbilical cord that he's talking about.
At C-section, with no injury to the baby or the mother.
No injury to the baby, very important, guys.
So then the next type we use is cultured Wharton's jelly. So on that one, we harvest it from the placental tissue. We grow it for a month or whatever, and then we either inject it fresh or freeze it, and then you just get it later. But one placenta could provide thousands of doses, okay?
Wow. Well, what about that? With the placenta, that's something you can culture, multiply, and get more stem cells out of, right? Same with the umbilical cord also, right?
The cord blood doesn't culture as well as the placental cord tissue, so you can culture it. It doesn't respond as well to culture as the connective tissue, in our experience.
Okay, which would be the placenta, right?
Right.
And then also, if you take someone,
so we can take your own fat or bone marrow and we can grow that.
Okay.
And that's also very effective. I've done it myself, and I mean, I've done all these different types of stem cells myself.
Oh, great. But, where have you done them, by the way, if you don't want me asking?
So I did them in China, and I did them in Slovakia, and then
with your own bone marrow?
The ones I did that were my own bone marrow were in China.
Okay.
And then I did the cord blood ones in China, and also the cord blood ones in Slovakia.
Okay. And it was in knees or elbows or?
No, in New York, in my office in New York, my physician assistant, Tara, injected my knees with bone marrow aspirin. Okay. And then at a clinic in New Jersey,
that's from the hip,
a colleague of mine, right, injected a fat stem cell thing into both my knees. And I found them both to be very effective.
They're both in your knees, right?
Yeah, I just did the one time I just had my one knee injected, and the other time I had my both with the fat.
Okay.
But I found it to be very effective, and overseas I haven't had a joint injection with the stem cells, but we have a lot of experience with it in Slovakia. We've done, I think, hundreds of joints, or at least 100 joints so far.
Wow. And what trouble were you having in the knees before, and how was the effect after?
So basically, in my left knee, I never really had any problem. My right knee, I had a partial ACL tear and an anterior horn meniscal tear.
Okay.
And of course, I didn't want to have surgery. So I did the stem cell treatment, and it worked. They both completely went away.
That's great.
And I ski, and I don't have to wear any kind of brace or anything like that. My knee feels totally stable. Whereas before, I was having a little rotatory instability in my right knee, and it's pain, of course. But that's all gone now.
That's terrific. So that's been kind of wiped out, so to speak, which is really great.
Right. No. So I think, the best, if someone's got like joint pain, the best thing to do is take a portion of the cells, the cord blood cells, and inject the joint directly, and then give the rest IV. Because even just the IV treatment gives joint pain relief. And for back pain, there's so many joints in the back. Too difficult to inject each one, so you just do like an IV treatment.
That's terrific.
For back pain. We've had some really dramatic results with back pain, and some people have had absolutely complete relief of their pain. 24 hours of an injection.
Does it act as an anti-inflammatory, or let's say it does, right? And for people who have disc issues in their back, like bulging disc or ruptured disc, you know, does it actually alter the disc in any way, or just the inflammation?
We don't know if the disc regenerates, okay, so that would be amazing, right? So it seems that most people with really severe disc disease and back pain, they do need to repeat the treatment every year or two or something like that.
Okay.
And the pain doesn't usually ever come back as bad as it was before the first treatment.
Wow.
But it does tend to creep back after a year or two. So we have had patients that, you know, they come and do another treatment, but they just do it, one IV treatment is enough, I would say probably at least to last a year, generally.
And so one IV treatment, you go in for like an hour or so or something? Or?
Probably like 2 hours, so they, you know, they check your vital signs, and then they start an IV, they run a little saline in, and then they give the stem cell treatment, and then another little dose of saline, and then they check your vitals, and then you're done. So the whole thing would probably take about 2 hours.
Wow. And do people have, like you were saying before, you have trouble sleeping after it a little bit?
The main side effect that people notice is that they have a little difficulty sleeping for a couple weeks.
Wow.
So most people, I would say at least half the people, maybe even 75% of people, need to take Ambien or some kind of sleeping pill for 2 or 3 weeks after the treatment.
They just have too much energy to sleep.
Exactly. They just have a lot of energy, and you could, my friend Eddie, the first time he didn't sleep for 2 weeks, and I said, you better take Ambien because you need to sleep, and then he did, and he started sleeping. And then, that's pretty extreme. Most people, it's just a couple weeks, and then they came back into sleeping without a sleeping pill. And then, but they usually sleep a little bit less, so maybe you sleep like 5 hours. But you wake up, feel totally rested, want to go up to the gym, whatever.
And also, for this IV treatment, you can use any type of stem cell, or there's a specific kind for that?
Okay, so for IV treatments, you really shouldn't use the kind that you just get from your back or your fat or something, okay? Because that could maybe cause some type of blockage of a blood vessel. Okay?
Oh, wow.
So normally that would be, so the one that's FDA approved, we wouldn't, at Blue Horizon, we wouldn't inject that IV. Certainly wouldn't inject it, not inject it intrathecally. Of course, I think it's probably okay to inject intra-articularly, which is into the joint, and intramuscularly, which is like someone has a pole muscle or something like that. You can inject that. And also people inject their face with it, you know what I mean, for wrinkles and stuff like that.
But to put it in the arm for an IV, that's also done too? Or?
Well, for that we would use the cord blood, the cultured Wharton's jelly, or the cultured person's own fat and own bone marrow.
Wait,
so if you culture it and grow it, then you get a pure, not pure, but you get a relatively pure cell line, okay, that's clean and doesn't have a lot of, because when they culture it, they rinse it every day with or not every, I don't know how often they change it, but they rinse it with growth medium. The cells actually secrete these growth factors and stuff into the growth medium, and we make a cosmetic out of it now. It's amazing.
That's amazing.
So you're not getting the other debris and stuff like that you get when you do the aspiration.
That's interesting. It's a very new world, I think, for all of us, including me, who's trying to be introduced to this new world. And I think this will help, I hope it helps everybody kind of get a better idea. Like I was saying before, for those of you guys, who are just joining us, who don't know, again, we're with Brian Mehling and Greg White from BeyondComics.tv. And again, one of the important things, especially in my career, being someone who creates comic book superheroes, and I work with all the celebrities like Ice-T and Coco on the different TV shows and doing things like that. It's a tremendous amount of physical activity that we're doing, and then when we're drawing on a desk, it's the opposite. We don't move. So we're stuck in one position for 17 hours straight. It's like torture. So, it's the same as people who work a 9 to 5 and they can't leave their desk.
Right.
So it's creating more and more joint injuries, back injuries, etc. So one of the other things I wanted to just kind of circle back toward was in the research that's been going, amniotic stem cells have been kind of potentially on the rise. Is there anything that those treat better than the other types of stem cells?
Okay, so they now have amniotic fluid stem cells available on the market, and those stem cells are harvested from the amniotic fluid of, I assume, a healthy baby. And I haven't used them myself personally. I can't imagine there's very many, so I really don't know about the potency or something like that, but I do know it's available, and I don't think it's going to be a very significant number of cells.
There's
also two other types of stem cells that I just wanted to touch on while we were going over, just to be complete. There's fetal stem cells, which are harvested from aborted fetal tissue, and those have been used in the past. I'm sure they're still used today in some places. That's one of the types of cells that were banned under Bush, basically, when he limited the stem cell research to only adult stem cells. The cord blood, the Wharton's jelly that I talked about, those are adult stem cells. Okay, those are harvested with no injury to the baby or the mother. Obviously, the fetal tissue is harvested at an abortion, basically. And then the embryonic tissue is the other type of stem cell that's pretty prevalent in the research community, and those are harvested from fertilized eggs. So people go to fertility clinic, they want to have another baby, but they fertilize a bunch of eggs, and then they only put one or two in to the to the patient to have the baby, and then the rest are in the freezer. So those were also banned, okay, because they're fertilized eggs that could eventually, of course, grow into an adult, like you or me. So those types of stem cells are also used for stem cell research and treatments, and those two types of stem cells, the fetal stem cells and the embryonic stem cells, have been linked to tumor formation. So not really as much cancers, but tumor formation, like a benign type of tumor. They could still be linked to cancer formation. I'm not so sure about that, but definitely there's a clear link to tumor formation. And the adult stem cells, the ones that are harvested after the baby's born, those have not been linked to tumor formation or to cancer formation either, as far as I know. But we're just about to publish 3, 4, and 5-year safety data.
Just continuing, that's a very important point that you were making with regards to the different types of stem cells. So now, when it comes to the cord, it can be used here, but only by one family member removed, right? So a mother can give it to her son, or I guess her sister's son, or something like this. It must be very close in the family. Is that right?
Yes, I'm really sorry I'm doing this text.
Oh, sure. We just got an emergency text here, so we have
sorry. So basically, can you just repeat the question again?
Oh, yeah, sure. I was just saying that, so basically, we were talking about that in the United States, the cord, the umbilical cord, if they freeze it or they use it for family members, it can only be used for the mother's child or the mother's
first degree relative.
Right.
I think it can be maybe the second degree can use it and the third can't, but at least there's a pretty sharp limit. Okay, so that's totally legal and that's great and it's something, but you need to expand that because it's very difficult. Not everyone has a family member that just had a baby. You know what I mean?
Right.
It's a little inconvenient for someone that just had a stroke or something like that. It would need 3 family members to have babies.
That's
right.
Right. Be popping them out and storing the umbilical cords, you know. It's like a Dracula movie or something. Yeah, right. But oh my gosh. But and also, what about your research on? You said that you might be looking into the amniotic stem cells one day. Is that right?
Well, we're not really doing amniotic stem cells that much at Blue Horizon. No, actually not, I don't think so. The problem with amniotic tissue stem cells is they're harvested while the baby is still growing in the mother, okay? And so there's a risk of causing an injury to the baby because even a slight draining of that amniotic fluid could injure the baby and also introduce an infection which could cause a miscarriage, okay?
Oh my goodness.
There is a product that's already FDA approved on the market where they take the amniotic sac from this, the C-section or whatever, and they cut it into little pieces and we can put it into the wounds for surgical healing. So I do that and that's FDA approved. And you can inject it in the joints and stuff like that. No, it's just like the stuff that we use. The baby's born, the baby's fine. Then they take the other stuff and they use it because it's full of stem cells, basically. So you can use the amniotic tissue in surgical stuff.
It's great.
And I use it myself, and it's great. It's wonderful. That's already FDA approved. But that's not like injecting it. That's not injecting 300 million cells into your body. You know what I mean? That's taking a little tiny piece and putting it in the wound, which is great. I don't want to minimize it. It's great, but it doesn't give you. you're not going to need an Ambien to sleep for 2 weeks. You know what I mean?
Right, exactly. That's the big difference. And also, though, what about, let's say, if somebody comes into the office and they have a shoulder injury or a knee injury, can they utilize the amniotic stem cell injections to help heal that, or are there not enough stem cells, or not sure yet?
Okay, so again, it's kind of like you can use the amniotic injections into your joint. You can do like the same day fat or bone marrow injections into your joints.
Is any of those three, which of them would be the best and why?
Well, I haven't tried the amniotic tissue one, but I did try the other two.
Okay.
And they were both probably equally effective.
Okay.
But the one with the fat did cause pretty dramatic joint pain afterwards. So I had to take a Percocet for like a week just to walk, basically.
Really?
Okay, but that inflammatory response that results, some of the thinking is that that contributes to the healing response, okay?
Is that like prolotherapy when they purposely put in the water, they kind of swell it so that it forces the stem cells to attach to the injured area?
I don't know about that therapy, but that doesn't sound like it would be effective to me. Now, maybe some people get a benefit from it, I don't know.
Okay.
But if you're going to swell the whole knee with fluid, you're going to take the fluid out, right? So you're probably going to take everything that's in your synovial fluid out, and your synovial fluid has some very important protective agents that will reconstitute. I don't know about that particular type of treatment. So it doesn't seem to me, though, that it would certainly not be as effective as injecting 100 million cord blood stem cells into your joint, which I think would really help the joint surface as well as, a meniscal tear or a ligament injury.
Does it work to heal muscle tears as well?
Yes.
And what about bone deterioration? For example, if the joint is a little deteriorated or there are little holes in the bone?
Yes, it helps. So basically with arthritis, we think that it helps the
osteoarthritis?
Osteoarthritis, post-traumatic arthritis, rheumatoid arthritis, pretty much any kind of psoriatic arthritis. It seems to be effective for all those different types of arthritis.
Okay.
And it looks like from our preliminary data that it does actually help regrow cartilage. So we don't have any firm data on that yet, but we have some research projects, in the works, and hopefully maybe this summer we'll have some quantitative data on it.
And is there, how long does it take for patients to see improvement? And if so, is it like a 70% improvement or 60% or what seems to happen?
I would say at least 75% of people see a pretty dramatic difference within 48 hours.
Really?
And then probably maybe 85% see it within 7 days.
Really?
And then some people don't see much of a response, you know what I mean? But if you observe them, they are definitely having a response, you know what I mean? They don't use their cane anymore, they don't seem to notice it, you know what I mean? But they are, or their mood is better, they don't maybe notice that they are happy or whatever, but the people around them notice.
Is that with the combination of doing the joint and the IV?
Well, as far as the systemic effect, that's the IV. So if you're like feeling better and have more energy, that's not because you injected your joint. You know what I mean?
That's just IV in the arm, right?
Well, yeah, the hand or the arm or something like that.
Okay. And is that okay to do now in the U.S. finally, or is that still being?
No, the ones that you harvest your fat or harvest your bone marrow and inject it the same day, that's legal in the United States.
In the IV or
no, you don't do those IV. Those are just in the joint or in the muscle.
Oh, okay. The
IV injection, it would be legal if your sister's kid.
Oh, that's
donated.
the cord.
Okay, so that would be like the cord blood.
Oh,
so if you have a 1-degree relative, then you could do the IV of that cord blood.
So guys, just to be clear, to reiterate, to recap, basically, if I understand correctly, you're saying that only the cord stem cells can be injected intravenously, right?
Well, I mean, safely anyway.
Safely.
You could put the other ones in too, but who knows what's going to happen,
Risky.
right? Well, maybe you could get a clot somewhere or something like that. So I don't know what would happen, but I wouldn't do it myself.
And amniotic you would not do either, right?
Well, the amniotic you theoretically could because it's just like a fluid. There's an amniotic membrane, which is like a little square of tissue, and they also have like a pulverized version, which is like a gel, and that you could probably inject into a joint but you wouldn't inject that IV either. You know what I mean? There is an amniotic fluid, and I can't imagine someone injecting that IV. I suppose you could. I've never heard of it.
I see. So like when they talk about using amniotic stem cells in knee damage or shoulder rotator cuff damage, what type of amniotic stem cells are they using or getting it from in the U.S. currently?
Okay, so there's a couple companies, and they harvest the amniotic tissue from the sac that the baby's growing in when the baby's in the mother, and they cut it in little pieces and they check it for diseases, and they put it in little foil envelopes and they sell it basically. Okay,
I see.
and then there's another one where basically it's like a gel or something. Okay, so those are commercially available. They're FDA approved. They're pretty expensive. I'm just generally using it in the operating room, but I suppose you could at some point inject it in your office. Okay. I haven't really looked into the price of the product for that type of application.
But do you think that there may not be enough stem cells harvested from those little pieces? Is that the idea?
Well, I'm sure it's more effective than doing nothing. I don't think it's as effective as what you do, where we take the entire yield of one placenta and inject it IV and intra-articularly, or IV and intrathecally, okay, or just IV, because you're getting such a much more substantial dose of stem cells, okay?
And that's only overseas, right, for that? Unless
right.
you
So
are
currently that's just overseas, but hopefully, you know, with maybe some changes in the regulatory environment, that maybe we're doing it this summer or next fall or whatever, you know what I mean? So I really do think we're going to see a pretty rapid progress in the United States. I mean, clearly, the United States is quite a ways behind some other areas of the world, but, you know, we could get caught up in a year, maybe, I don't know, you know what I mean?
See, one of the big things that a lot of the emails I received were people, I think the reason why they seem to be more interested in amniotic is because they don't have to have any aspiration, they don't have to have any liposuction, they don't have to have their body touched. That was one of the big pluses that but they were concerned, would it be effective? And also, since there are these two different types of amniotic you mentioned, which one, if it was you, for example, which one would you think would be better to go for?
So, if you're putting it into like some soft tissue, like into an incision, which is a lot of ways that I use it, you would use like the little square, okay? If you're going to inject it into the joint, which I haven't done yet, but I am going to start, you know, potentially doing, maybe even this month or whatever.
Yeah, and guys, I'll make a follow-up video to find out what your findings are, so we can continue getting them back.
So my experience with the little squares of the amniotic tissue have been excellent. I haven't had one patient that's complained. It seems everyone's had a rapid recovery from their surgical incision or their surgical procedure, and it is expensive. I don't know exactly what the cost is. Like, I can't imagine it's less than a couple $1,000s for the little square. You know what I mean? And then the paste, you know, I don't really know the price of that either. I have to look into it. When I use it in the operating room, so it gets billed to the insurance company.
I see.
Okay, so that it gets billed to the insurance company, and hopefully the insurance company pays for it.
And it's a paste, right? Like
I think it's like a gel. Again, I haven't used that one yet. I know it's available on the market, but I haven't used it myself.
And that's potentially injectable into joints.
Yeah, potentially in your office. You could probably just inject it in your office. And I mean, when we have our follow-up talk, I'll get the pricing for you.
That would be great. Yeah, I'll post a follow-up guide to inform you as well.
I mean, for the hip aspiration and the fat aspiration in my office, I think we do those for about $3,000 each. You know what I mean?
Okay.
So it's not really that expensive. The stem cell treatment, the IV stem cell treatment, is $10,000. We're having a little reduction in Slovakia now, which is an hour from the Vienna airport, and it's only $5,000 now, but I don't think that'll last very long. Kind of just a little incentive, basically.
I see. And also, like with people that
in
are
China, what we do in China is 10,000.
Well, that's 10,000 in China, right?
In Jamaica, it'll be 10,000. Yeah.
And the benefit again, for those of you guys who are just tuning in, that has to do with the fact that overseas you can culture them and grow many stem cells versus in the U.S. where you're stuck with whatever you get, right?
Okay, well, and also in the U.S., remember, you can't just inject the cord blood unless it's your first degree or second degree relative, okay?
Yes.
So overseas, there's no restriction like that. I mean, in some countries you can't go to Canada to do it, you can't go to England to do it, you can't go to France to do it. I mean, most countries in the world have exactly or similar restrictions as the United States has, okay? Yeah. There are some countries where you can do it with the proper licensing and stuff like that. It took us, 2 years to get our license in Slovakia. It's not like everyone's doing it.
Sure.
It took us a long time. We had to fill out an amount of paperwork, and our lab had to be inspected, everything like that,
sure,
before we were given permission to start doing it. And we still have permission to do it like experimentally. Okay,
it's great.
In Jamaica, we have full permission to do it non-experimentally, but of course, everyone's enrolling in a research protocol anyway.
Gotcha. Gotcha. And how do we assure the people out there who I think there was some report, what was it, 2020 or something, where I think it was in Mexico or somewhere, where they swapped out the people's stem cells and one of the lab techs or the technician assistants sold it overseas and they replaced it with animal stem cells that didn't have anything in it. How do we, or how do you protect against just random staff who you never even met, who's just handling stuff from doing things like that, so that the patients don't have to think twice about it, so to speak?
Okay, well that's probably the biggest problem in the stem cell, treatment culture worldwide is all of this very, very, very low quality product being injected into people. You know what I mean? And you could die of a meningitis. I mean, it could be fatal.
Terrible.
So we've never had a complication, but we have an unbelievably rigorous, procurement protocol for obtaining the tissue, and we just do a ton of testing, and then we publish research. So people really should look for, how many live cells are they getting, how do they verify that, what diseases has the tissue been sampled, how do they know where they got it, where was that baby born, how old is the mother, is the mother married, did the mother do all her hepatitis and HIV testing, where's the information on that?
Do you provide that to patients?
Well, no, we don't provide it, but we have access to it. So, we know that the mother did her prenatal testing. We know that the mother, delivered by C-section and the baby was healthy.
Okay.
I have a feeling that a lot of stem cell providers worldwide can't provide any of that information because they get some material. We use the entire yield of one placenta for one dose, whereas most people divide that into 8 or 10 doses.
Okay.
It's a different situation. And some people, I'm sure, there's probably no live stem cells in there, you know what I mean? Because the tissue isn't handled properly, so the stem cells may have died already. And so you don't really know unless they verify before they do the injection how many live cells there are.
I see.
So that's done under a microscope. They actually count the live cells, they count the dead ones, and then they say, okay, well this is one high-powered field, how many live ones are there, how many dead ones are there, and then that's the percent of survival. So usually you would hope to see at least 19 live cells for every one dead. That'd be 95%.
Wow, that's amazing. So, if you were the patient, what would you tell them to do so that they go to the right source? Let's say someone's watching.
We should ask.
Yeah.
You should ask to speak to a doctor, I suppose. Okay, because I'm sure a lot of these places they don't really have doctors.
Okay, like an MDs.
And talk to the patients. And then also you need to verify how many cells you're getting, how they know those cells are alive, where they got their cells from, what diseases have the cells been checked for, how many complications they've had in the past, how many patients they've treated in the past. You probably want to get a copy of any published research that they've done. If they haven't published any research, that's probably something that you should be concerned about. You know what I mean? Because they probably haven't taken the time to, really develop a quality product if they haven't published any research yet.
So when you hear people popping up, I know for example there are chiropractic offices and different places that are offering to do things like that. Are they privy to the same information that your facility has?
Okay, so for the chiropractic office is doing stem cell injections, they're probably using the kit that you can get and it's FDA approved, and they're probably fine for that. You know what I mean? I'm talking about people that are looking for cord blood or something like that. Okay, so if you're just looking for, a bone marrow concentrate injection, that's readily available in the marketplace.
Okay.
Go to a surgeon or somebody that you trust, ask them, I guess, the same questions. See if they tell you how many stem cells are in it. If they tell you there's a certain number, they're probably just lying because I don't know that information is readily available.
Wow.
But certainly ask how many patients they've done, and Google them, whatever, see if that's what they're up to, and it should be fine. But worldwide, if you fly to Mexico and think you're getting a stem cell treatment, how do you know?
Right.
Where do they get those stem cells? When was the baby born? How was those cells handled from the time the baby was born to the time you're getting them? Do they check for diseases? Do they check for endotoxins and things like that? So, you don't know until you ask. If they say that, say, I'd like to see the documentation. I'd like to see the test results. I'd like to see that negative HIV test.
Well, that's smart. That's actually a very good idea. So they can just, as the patient, walk in and ask the facility that they're in.
Well, you're going to call first, you know what I mean? Call and ask the questions. But those are some things that, probably an informed patient would want to know.
That's great. Like you would ask that if you were the patient, right?
I mean, I would now. Actually, when I did my first treatment, I didn't really ask many questions because I already kind of knew of the guy. And,
I see.
But, they still weren't very as thorough as we are now. So now we really kind of enroll each patient in a research protocol. Okay. We have a huge questionnaire they have to fill out. And we do a bunch of blood work before and after so we can get safety data so we can demonstrate that the treatment is safe. And then the next step for the FDA would be an efficacy study. So the first step is a safety study, and then the second step is an efficacy study.
That's wonderful. So like if patients come to you and they have those questions, you could give them those answers, as where some of the other places may not.
Right. So for instance, we don't have a card that has that information on it in Chinese or whatever in the file, but we do have that information, in our facility in China. So if the patient really wanted it, I suppose we could have them email it.
Oh, that's great.
So
they know what they're
getting. We've done thousands of treatments and haven't had one complication. So I've done the treatment myself more than 30 times. So
that's great. And they run those tests automatically in China for all of that, HIV tests?
Well, most families in China, because they have kind of the whole one, now it's two baby policy, right?
Yeah.
So there aren't any single mothers. There aren't any, crack whores or whatever. You know what I mean?
Right.
If someone's having a baby, they are married and they plan it. Their whole life is that one baby, you know what I mean?
Sure.
So now they're allowed to have two babies.
They donate this, or they sell it? Is that what they do? The parents?
No, they donate it. Okay. We don't compensate the family in any way. Now, what we may start doing is preserving some of it for them for the future. Okay? Because we process it just as if we're going to bank it. In fact, we do bank it often.
I see.
But currently we don't. But we may change that policy and start setting aside like 5% for the patient for the future. Just as a thank you, which would probably be a good idea.
That's a really good idea.
But
you can do that in Jamaica also now that you have a new office, right?
In Jamaica, we're not going to take the local tissue. Okay, we're going to bring the tissue from China. Okay, because in Jamaica, maybe at some point we will. We just started taking tissue in Slovakia after being open for several years.
Okay.
So part of it is educating the local mothers who are pregnant about thinking about donating the cells. And then the other problem is, in China, it's very, very common to have a C-section with a perfectly normal baby, okay? But in the West, people don't usually have a C-section unless there's a problem, you know what I mean?
I see.
And that would automatically disqualify the, the cells for use by us anyway.
Right.
Because the baby has to be totally healthy. So.
Okay. And so the idea is that in what you're able to use here in the U.S., all that stuff has to really be from the actual source, the person themselves.
Right. So for 99% of it is the patient's own stem cells going back into them, which again is effective. It's just not as effective. So for instance, when we culture your own cells and inject them, it is effective, but it's not as effective as culturing the Wharton's jelly, which is the connective tissue of the placenta, or giving the cord blood. Because those cells are...
Can they do placenta here if it's not related in one or two family steps or not yet?
No. So that's probably going to change, hopefully pretty soon.
Okay.
You know what I mean? But currently, today, you have to be related to the donor. There are some research. There are some research protocols. There are protocols going on in the United States. You may be able to enroll in one and get it somewhere. You know what I mean?
Interesting.
There's plenty of protocols out there, and they are enrolling patients, but not to the general
search
public.
for that. They search clinical trial.
I think it's clinicaltrials.gov.
Okay.
It has all the clinical trials on it, and eventually our clinical trials will be on it. So they're not on there yet, but hopefully later this year.
Can the husband use the wife's placenta stem cells?
Right, so that'd be first degree. So yeah, so if a man and a woman have a baby and they bank the stem cells and the husband has a stroke, they could use those stem cells for the husband. That would be perfectly legit with the FDA.
And they could do that in the joints also, right? If he has a shoulder injury,
injury,
that's okay.
They could do it.
So there's some progress being made, which is good.
I think that's been for a while. I don't think that's recent. I think that's been pretty much for a while you've been able to do that. I don't think that's been a problem. But again, how many people have someone that just had a baby in the family? That happens, of course.
And sorry, which is better, umbilical cord or placenta for knee and shoulder injuries?
I don't really know which one is better. They're probably about equal.
Okay.
So I really don't know if one is really better than the other. We don't have much experience injecting the cultured Wharton's jelly into the joints.
Okay.
It's probably just as effective, but we haven't done a lot of it yet.
Is that the amniotic, or that's different?
No, the amniotic stuff we don't really offer currently at Blue Horizon, but it is FDA approved, at least the little squares, and that would be something that the doctor would purchase from the vendor and then could place surgically into the patient. Or there's a gel that they could inject.
I see. Now, could they take multiple gels and do multiple injections for more? You know what I mean? More.
I don't know the cost of it, but I suspect that would be pretty expensive.
I see what you're saying. And is it painful? You mentioned belly fat being injected in the joints. It's painful.
Well, that was my experience. Not everyone has that. I mean, I know that some people are just fine. I happen to have pretty significant knee pain for about a week.
Wow.
But then my knees felt great. You know what I mean? So some people think that inflammatory response that comes with the pain that you get at the injection actually helps stimulate the regeneration of the damaged tissue in your joint. So that's a theory. I don't know. You know what I mean?
What about aspiration from the hip? Putting that in, does that also cause that same type of pain, or is that okay?
Well, I haven't had a hip injection, but theoretically, you could do the same injections in the hip. In Slovakia, we inject the hips and the knees all the time, have great results.
I meant instead of using belly fat, using the bone marrow from the
Right, so you can use the bone marrow into the knee, and I did that myself, and that's FDA approved.
No pain for that version?
It was less for me. But
painful.
someone could have a different response. You know, someone else could have more pain with that and less with the top. I don't know. You know what I mean?
Very interesting, very interesting. So there's like two different kind of part for it, where some people can react, some people not.
Yeah, like some people don't like, you know, it's just like anything. Some people can drink milk, some people can't. You know what I mean? Some people can have eggs, some people can't. So it's your own tissue, so it's like not like a foreign protein, but some people may have one response and some people different.
Okay, and have you experimented with any ozone injections to help speed up recovery?
No, I haven't. I've heard a little bit about it, but I don't have any experience really with ozone injections.
Have you heard that they're good, or what have you heard so far?
I didn't hear that they were good, so I haven't heard, you know, really much about it. I just heard briefly about it, but I really don't know if they're good or bad.
And here we go, guys. So again, this is what you've been waiting for, which is actually going through some real MRIs. We have permission to read this. So let's start with the first one, which deals with, it says here, there's a right shoulder. Yes.
So this is a right shoulder rotator cuff, and I'm an orthopedic surgeon, so I treat these types of things all the time. And basically, there is an intrasubstance tear in the superior margin of the tendon. And
does that mean it's detached from the bone?
No, that means it's a partial tear. Okay, so there's. You want me to go through the whole thing? Right?
Sure. Yeah.
So the rotator cuff, there's a partial tear of the rotator cuff, and it says more than 50% thickness. So something like that is probably going to go on to tear completely at some point. Okay. So that's probably going to be something you might want to do something about. Okay. Then there's a coracoacromial arch and AC joint. There is some bursitis there.
And the AC joint is where? Right
that's
here?
where your clavicle attaches. It's right here, basically.
And there's a tear there also?
No, that's not a tear. This is a joint. Okay, so sometimes this joint bulges out or gets arthritic, and it can press on the rotator cuff. So in this particular patient, it looks pretty good. But if there were a lot of problems there, you can shave off the other side of it arthroscopically, and for instance, you can repair this rotator cuff tear, and I think the stem cell injection would definitely help this patient.
And would the rotator cuff that you had read for the tendon, would an injection be enough to have it repaired without surgery?
It might.
Interesting.
Yeah. So the glenohumeral joint, this doesn't show much arthritis, so that's good. But if it did, again, I think that a stem cell injection would help.
And where's that located also?
That's where the ball part articulates with the saucer part of the shoulder.
I see. And for the first thing you read about with the tendon, that's where, right here?
Well, this rotator cuff kind of comes like this, okay, from your back and like this way, and it helps you move your arm, okay? So it's an envelope of tendon and muscle surrounding the humeral head.
I see. And when it says there's a tear, they're talking about where in the front?
Well, this one's like on the top, okay?
Oh,
in the supraspinatus, there's 4 main muscles there, and so one of them is the supraspinatus, and that one's 50% torn. So
that's like right here, right?
Basically.
Where it's like this, if it goes like this is the arm into the body, so it'd be like right here.
It attaches on the humerus, so it starts right here on your scapula, and then it comes across this way.
And it's ripped somewhere there, right?
Right.
Gotcha.
So if you were in the United States, you could just do like either a fat or bone marrow concentrate injection, and I think that would be effective. But if you came to, for instance, Jamaica or Slovakia, we could inject the cord blood stem cells IV and also directly inject the shoulder.
Wow. Wow, that's amazing.
So the next one here.
Oh, was there something on the bottom of that, or
no? You got that.
Okay.
So the next one here is a cervical spine,
which is the neck,
MRI, which is your neck. Okay, so a frequent area for pain. People have a lot of neck and low back pain, and so in this patient, there is some disc protrusions and disc bulges, and there is a disc protrusion is kind of a little bit like a herniation, so it's disc material that's degenerating and coming in contact with like the nerves as they exit the central nervous system. So
that's toward the back and right. Is that what it says?
Well, I'm reading down here in the summary. It says right, but there's probably problems on both the left and the right. So for this type of patient, we would generally just recommend an IV infusion of the stem cells. We wouldn't individually normally inject each different layer, although you could do that, okay?
You could do that, right?
Probably would get a perfectly satisfactory result just by injecting it IV.
Gotcha. And sir, just before we go to this one, if we go back to the shoulder, because it affects both the right arm in this particular case, and how does one know which is having pain down the arm from neck versus shoulder?
Okay, so it can be coming from both, okay? So you don't know if it's one or the other, but the nice thing about the stem cell treatment, it would treat both. You know what I mean? The IV treatment would treat both of those symptoms.
Okay? It would treat, right? And in this case, I know the patient has said they're having radial pain throughout the nerve, right, wrapping around right into the forearm there. So that's what I'm wondering is that...
So if it's extending beyond the shoulder down the arm, it could come from the shoulder or it could come from the nerve. So,
wow. That's interesting. But could there be something directly from the elbow if he's getting pain?
Yeah, so people can also get nerve entrapment at the elbow, at the wrist. Everyone's heard of carpal tunnel, that's nerve entrapment at the wrist. So in general, the stem cell treatment, IV, would help all of those. Wow. You could individually inject, but you probably wouldn't need to.
And you think one IV injection would do the trick? And that's okay in the U.S.?
If it's your brother's kid.
Gotcha. Okay.
All right. So if you're someone in your family just had a baby yesterday, save that stem cell, and then you can do it yourself. If not, well, then you might need to fly to Jamaica or Slovakia or whatever.
That's right. Gotcha. Again, I just want to repeat some of it for those of you who watched the other videos since we're breaking it into parts so that they could follow along.
Exactly. So, all right. So this is a knee to keep things moving. So basically, there's a small cartilage loss in the knee, which is basically arthritis, and then there is doesn't look like a meniscal tear. So this person has a little bit of arthritis in the knee. That would be great to treat with an intra-articular or joint injection of the stem cells, and then we would do half IV. If they didn't want to leave the United States, then basically they could just do the fat or bone marrow concentrate injected into the joint. Okay,
and the stem cells are the same from the fat and the bone marrow?
They're different. No, they're different. They're different. But they both seem to be effective. You know what I mean?
Interesting. Can you tell our viewers what some of the main differences in regards to what one treats better than another?
Well, to be perfectly honest with you, I don't think there's a lot of difference between which one treats and which one doesn't.
Okay.
The ones from the fat do tend to be used much more for like cosmetic procedures where they inject people's face.
Interesting.
But they both are used pretty widely for injecting joints. I don't think there's been any like head-to-head comparison of which one is more effective. In my experience, they're both effective. And they're both about the same price. You know what I mean? They're both pretty much
So there's no stem cell that's geared towards, oh, this one works better in knees, this one works better in shoulder, this one works
Those are both from the same germ line. So those are both mesenchymal stem cells, okay? There's other stem cells from different germ lines, but those are from the same family of cells anyway.
Interesting. And by the way, any difference extracting or aspirating the bone marrow from the sternum versus the hips?
Well, I think in my experience it's just a lot easier to get more from the hips than the sternum. I can't imagine putting a heavy needle into your sternum would be probably extremely
not fun, right?
We numb it, of course, I don't know, but you know, the sternal rub is what they do when they try to get people to wake up from drowning.
Oh my God, yeah.
So,
by the way, does it regenerate? How long does it take to regenerate the stem cells in the hip once they're extracted?
oh, I don't know, maybe a day, whatever. You're taking like a tiny, tiny amount of stem cells from your whole entire body stem cell.
I see.
So
it doesn't like take.
So you don't need to worry about that.
Okay,
no,
great.
they'll regenerate right away. Okay, so this is the knee, so that would be good for that.
Okay.
And then we got another one here, the lumbar spine. Okay, so that's the other end.
Actually, wait. If we go back, this was the other knee, which had a different. This is the right knee, has a different.
Oh, the right knee. No, this is it.
The last one. Yeah, the one that I think you first did was the left.
Oh, I got you. Okay.
Yeah. So then the other knee is the other issues.
Oh, okay. So this one had worse arthritis. Excuse me. Yeah. But this one has worse arthritis than the other. So it would basically be the same. The same treatment.
Same treatment, right?
So this one's a little bit worse than the other side.
When it talks about there being that little hole, did you see? I think it was
1.1 by 1.4 centimeters.
Which
so
is
that's a defect on the surface. So there's some orthopedic surgical procedures you could use to fill that. You can take little, circles of cartilage and fill it in.
Really?
Perhaps the stem cell treatment would be enough. I don't know. This knee is a little bit worse. So I would just initially probably just try an arthroscopy of the knee and kind of surgically, and then follow that with a stem cell injection.
And if you compare that to the first knee that you read on the other page, I think there was it a 5 size?
0.8 by 1.2, so that's smaller.
That's small. And then was something here? Or?
0.5 times 1.2, which is even smaller.
And that's where? On the inner kneecap and the femur?
So one is medial femoral condyle, which is on the medial side of your femur. And then the other one is...
So guys, that's like the upper leg bone, like this, for example. Would this be a good example?
On the patella, right, which is the other side of the kneecap.
And then what is that? That's filling up with edema, right?
Well, edema in the bone is the bone's response to injury. So that's just a signal that you can see on the MRI. So when they talk about marrow edema, that shows an inflammatory response in the bone caused by the tissue, the joint surface damage. And so one of the things we can see when we do the stem cells, because we're doing a research project on this, is a decrease in the bone edema after the stem cell injection. So we did before and after MRIs, and basically the stem cell treatment seems to cause the bone marrow edema, which is what they see in these images, to go down significantly.
So, and that's just from the injection?
Yeah.
Wow. And is that, that's put in the actual femur bone?
No, from the response to the joint injection.
Oh, how interesting. Wow.
Yeah.
And so is what they're saying that it actually seems to fill up with water when someone's using
Well, the water, the additional fluid in the bone there is a sign of inflammatory or a reactive response in the bone for tissue damage.
Oh.
Okay, so when the joint surface is damaged, the area of bone next to it develops bone edema, and that's where we think the pain comes from, because there aren't any nerve fibers in the joint cartilage, okay, but there are nerve fibers in the bone, and when the bone edema, it's just like if your leg is swollen, it hurts. If your ankle is swollen, it hurts. If the bone swells, Okay, it hurts. Okay.
And how do they fix that as well? You were saying surgically they can also put something.
Well, you can drill it. You can put little patches of cartilage in there, which are very effective. I mean, that's a great way to go. But it's not as easy as just doing a stem cell injection, right?
Yeah.
So I would probably maybe lean toward just doing a light arthroscopy without doing the bone plugs, you know, with the plugs. Unless the area was a little bit larger, you could just probably drill that and then do a stem cell injection. Hopefully that would be enough to regrow cartilage in that defect.
Oh, so you're saying like do a combination of surgery and stem cells?
I think the most effective thing is to do an arthroscopy of the joint and follow it with a stem cell
And
injection.
arthroscopy, for those who don't know, is like...
It's like a small outpatient procedure where we use like pen-sized instruments to go into the joint and clean up the joint or repair the rotator cuff. For instance, on the rotator cuff, if that was a complete tear, or maybe even there when we look inside it isn't complete enough to repair it, we would actually repair that tear with some stitches and like a little anchor into the bone.
Interesting.
And then the stem cell treatment to follow would help the body heal that faster, basically.
It would, but you think it might work without the surgery too, right? Just with the straight
up. So I think that it would be most effective. The most effective treatment would probably be to do the initial arthroscopy followed by the stem cell treatment. The somewhat less effective treatment would just be to do the stem cell treatment.
And do you think that might be enough without the surgery?
It might, yeah. It might be enough without the surgery.
Wow, and what is it? It's like if there's, let's take the shoulder, if there's a tear, that stem cell blood that's being injected in there will have to kind of grow back together.
Okay, so this is an incomplete tear. Okay, so an incomplete tear, the two pieces haven't separated.
Okay.
If the two pieces are separated, you're going to pretty much have to sew them back together, okay? Because it's not just going to crawl back over, you know what I mean?
I see.
It's, you know, so you probably need to sew them back together, then it would heal. Since this is incomplete, it's just like, you know, thinner there, but it's still in continuity, okay?
Does it mean that it tore like, let's say this is it, does it mean like this part tore like that?
So if let's say you have a rope and you cut halfway through it.
Yes.
Okay, so then it's still intact, and then you give the stem cells and those little things can heal back, okay?
I see.
But if the rope is all the way torn and they're not even touching, how are those two cells going to grow back? Even if they do, the rope is longer than it was before. You see what I mean?
Interesting.
So then you don't have the same, you know, power for extension or motion.
That's
because the tendon is longer, so the muscle contracts, but it doesn't get the same excursion, okay? It doesn't pull as far. So where it used to maybe contract 3 centimeters or something, now it only contracts 2. Okay, so you don't get as much.
And how do you fix that? You said
to sew it back together. That would you need to have the surgery for the complete tear. I
see. And for the partial tear, possibly stem cell could be enough.
Could be just enough, right?
And would that explain why, like they were describing, some of the pain was that they can move this way, they can move that way, but they can't move back. They can't reach behind them. For example,
right.
Do this,
so that's one particular
that
area that's injured. So when you do that certain movement, the rotator cuff gets pinched. You know what I mean? And then, ouch, it hurts. You know what I mean? And then they you know, you
does that mean it's tearing more when they feel pain?
Yeah. So basically, this like a partial tear like this is probably like a wear and tear. That was kind of wearing away for a year or whatever, and now it's 50% torn. And if you don't do something about it, it's going to be 75% torn, and eventually it's just going to tear. You know what I mean?
Wow. And when you
so it's a gradual. Sometimes it's a gradual process. Sometimes it's just one single event.
Okay.
But a lot of times it's a gradual process over time. You know, overuse, whatever, carrying a heavy briefcase to work every day, carrying your suitcase, whatever, you know what I mean?
And like when you do the injection, do you have your patients like in a cast afterward?
No.
Or they just hold them?
You walk out of the clinic, whatever, you get in your car and drive home.
Wow, that's amazing. So that's incredible, guys. And don't forget.
If you have surgery, you're not allowed to drive to the general anesthesia, okay?
Right.
But if it's just the stem cell treatment, yeah, there's no restriction.
That's amazing. And then like it usually takes how long to complete to find out if it's done when it's done? Like a few months or?
Well, no. Basically, the patients usually notice an improvement within 24 to 48 hours, and almost everyone notices it within a week.
Really?
So, but then, you know, if they had surgery, well, then there might be a recovery, you know, frame there that maybe would be a couple weeks or a couple months, depending on the injury.
That's very interesting. And because that on the shoulder too, there was one point, I think it was, where was it there? One more back. Oh, sorry, that one. It's a clown card. Right.
Oh, that's all the way like the front.
Okay, there we go. So I remember like you had mentioned there was a tear in the front and the back, is that right?
So this one is the supraspinatus, which is kind of on the top,
Mm-hmm.
and then this other one is in the subscapularis, which is the one next to it, kind of.
So they're like here, basically, right? Like right up here, and it's like where the ball socket is a little bit, right? And then and they're both tendons or muscle also?
Well, it's the tendon. The muscle can also be torn, but they're talking about the tendon thickness here.
Oh, that's
okay.
Interesting.
And then it's generally where we end up repairing, because the tendon teeth, I mean, either one can tear, you know what I mean? And the stem cells would help either one regenerate. You know, for the next interview, we'll get a little chart, and I can do an illustration.
That's a great idea.
It'll be a lot easier for the viewers to understand.
That would be wonderful, guys.
Yeah. A diagram.
That would be terrific. Then they can see the actual.
All right, let's go on to the spine one.
Sure.
And then we'll schedule another.
Absolutely, yeah.
So here's your low back again. It's pretty much the same as the neck. Some disc bulges, which are pressing on the nerves. So this is another, this one's got a disc herniation. That means the disc actually bulged out into the area where the nerves are and can be pressing on the nerves. So this patient would benefit from probably just an IV infusion. They could do the surgery first to remove this disc and then do the injection, but probably they would get satisfactory relief from just the injection.
Interesting. I know that the main complaint on that was that it was like a nightmare the first couple of years, and then afterwards kind of desiccated the disc, so it's...
Right, so at 5 years, typically most people don't have the problem anymore, but who wants to be in agony for 5 years?
Exactly. Yeah, right, exactly.
So, at 5 years you're going to feel better. Well, what am I going to do for the next 5 years? Get addicted to Percocet, whatever.
Right.
The whole idea is most people don't want to wait 5 years, or why should they wait 5 years anyway? Why wait 5 days in a sense? Why, you know what I mean?
Well, see, what's interesting though is that like with the people I've spoken to who've had this kind of issue and it's been more than 5 years, they seem to be okay, but can't lift anything heavy or it re-triggers the inflammation.
Well, what else happens is they have this problem in other levels, okay? So another year, another one gets worse, and then it just crawls up their spine. And so basically the stem cell treatment, we think, would help all those levels repair and also decrease inflammation, so you're not experiencing the pain of
with the IV in the hand or arm, right?
Yeah, just the IV.
That's right. And we're hoping that they will open that up to being allowed to do that without having to have a relative related in the U.S.
It's going to happen sooner or later. So we have a foundation, Blue Horizon Charitable Foundation.
Yeah, tell everybody about it.
You can check out our website. It's bluehorizonfoundation.org, and we have a bunch of videos of patients who have had successful stem cell treatments. We also have a stem cell documentary coming out during the Tribeca Film Festival. We'll be screening somewhere in New York, probably on April 27th. So you can stay. That's being produced by Industrial Motion Pictures, which is industrialmotionpictures.com, and you can check out that to get the time and screening. We'll hopefully have a pretty decent sized theater if you want to try to attend that. Then what else is coming up? We're going to be in San Diego for the American Academy of Orthopedic Surgeons.
Wow.
March 13th to 18th. Then I'll be flying to Orlando and presenting our stem cell research in Orlando on Monday, March 19th. Then we'll be back in Florida, in Hollywood, Florida, for the Regenerative Medicine Conference, which is in Hollywood, Florida. I believe it's like the 8th, 9th, and 10th.
Oh, wonderful.
Presenting there. We have a booth there for our stem cell research foundation, Blue Horizon Charitable Foundation. Then, of course, in May we'll be at the Cannes Film Festival. We'll be screening the documentary again. So those are some of our upcoming events. Basically, the main websites are bluehorizonfoundation.org, bluehorizoninternational.com. We have BHI Rejuve, which is BHIREJUVE.com. And we have regenerative medicine techniques there where we can do hormone supplementation, like growth hormone and testosterone and estrogen and stuff like that.
How is that for like older men who need to have replacements? So is it helping?
Oh my God, it's amazing. I do it myself, and a lot of my friends do. Basically, as you get old, all your hormone levels drop. We'll have to do another show for this one. But basically, as you get older, your hormone levels drop, and it's safe, and it's legal, and basically what we do is we check your hormone levels and a million other things, and then we basically prescribe a treatment protocol to help bring your hormone levels and other important things in your body back up to like when you were in your early 20s or something.
Really? Is that with injections or?
Injections, like that. There's a bunch of different ways that you can deliver the
And you've tried the injections already?
Yeah, so I use the, I do a hormone replacement regimen which involves testosterone, human chorionic gonadotropin, human growth hormone, and then I take metformin and a bunch of supplements. I also take a Armour thyroid, and it's great. There's a different prescription for everyone's got a different, scenario, so we try to obviously tailor it to each patient.
How much does it cost for that consultation in the program?
Well, basically, we try to bill your insurance company for most of it, so it's basically $3,000 a year, and then we try to get as much money as we can from the insurance company. So we'll bill the insurance company and try to have them pay for the lab work. There's a very extensive lab work that's, to really find out everything that's going on in your body as much as possible. Over basically 40 tubes of blood.
Wow.
And a urine sample, yeah. And so we really do a very thorough evaluation of the patient, and then we recommend a treatment protocol, and then we follow them up every 3 to 6 months to see how they're doing and adjust the levels. So, and again, we would work with your insurance company to try to get as much of it covered as possible, but of course, insurance companies don't want to pay, so you might owe something.
Right.
So that's BHI Reju. Then Industrial Motion Pictures is our small motion picture studio.
Great.
We have a bunch of documentaries there. You can view it from the website of the films.
Does it work, by the way, on hair to put the PRP or the stem cells with hair? Or not?
Okay, so we're going to start that treatment in Slovakia and in Jamaica. So I haven't tried it myself yet. A lot of people who do the IV injections do notice their hair is thicker.
Interesting.
And feels better and grows more. Like people do have a statistically significant increase in hair and nail growth in our experience when they do the stem cells. Okay, but there is another treatment which we're going to start where they actually inject the area of the scalp where there's thinning hair, and that's supposed to obviously be much more effective.
Stem cell or PRP?
Stem cells. Now I know people do inject PRP for that, and PRP is kind of again, better than nothing, but I can't imagine it to be that effective, but some people have reported improvement. PRP is more like a growth factor injection. The growth factors bind to the platelets and they inject the platelets.
Okay.
So it's like a growth factor injection.
Interesting. And then the stem cell is specifically telling something.
So the stem cell is different. It's not, the stem cells has growth factors or maybe induces growth factor production, but it's much stronger than just injecting some growth factors. But again, the platelet-rich plasma is better than nothing, but it's not anything compared to the strength of a stem cell treatment.
Does the stem cell have the PRP automatically in it or no?
No.
It doesn't.
The platelet is a different cell that we don't isolate or multiply or promote or expand, basically.
Any point to use both?
I suppose, but it's like putting, it's like a drop in a bucket, you know what I mean? I don't think you're going to notice any effect of the platelet-rich plasma next to the
Stem cell much better.
No one has to take an Ambien after doing a platelet-rich plasma injection, you know what I mean?
Right.
No one's like, getting up at 5 in the morning to go to the gym after they do a PRP injection.
That's right.
I don't think maybe somebody is.
Right. And so guys, thank you so much for watching. We're going to follow up with you guys. And any last closing words to our fans?
Well, thank you very much, Greg, for having me on the show.
Absolutely. I'm so excited to see you here and to hear all this wonderful.
I'm looking forward to our next show. I definitely want links to your show. I'll put it on all my social media and websites and stuff like that. And I'd love to talk to you again.
Definitely. So as they say in comic books, to be continued. Guys, you are here with the master over here, Brian Mehling, and Greg White from Beyond Comics. Thanks so much for watching, guys. Make sure to subscribe and make sure to post your comments below if you have any, and check out some of our other videos. And as they say in comic books, as I said before, to be continued.